Hi, this is Jared Snider with Essential Wealth Advisors, and in this week we're talking about health insurance. Really focusing in on what your health insurance options are whenever you have a qualifying event, you separate from your company, trying to sort out what the next step is for you and your family in terms of making sure you have great health insurance in place on a go-forward basis. So, whether that's going to be a short amount of time and you just need coverage for maybe a few weeks or a few months, or maybe you're trying to evaluate sort of long-term, what's your plan, going forward. Today's conversation will hopefully equip you with some of the information that you might need to be able to make that decision. So whenever we're looking at health insurance options and you've transitioned from your company, there are 4 key options that I thought we should talk about today. So, if, as a preface to those 4 options, if you've separated from your company and you've reached Medicare eligibility, you're at age 65, then certainly you have good options there for yourself through Medicare and maybe a supplemental plan. But if your family members potentially haven't reached that point, or you may not be at age 65 yet, that's what today's conversation will hopefully equip you with the information that you'll need to be able to know what your options are. So those 4 different options I wanted to touch on. First off is COBRA. So COBRA is generally available, to individuals who are working for a company with 20 or more full-time employees. And COBRA is really just going to mirror the group coverage that you had at your employer. So that's the benefit. You get basically the same coverage. The downside is it's expensive because now you're on the hook for 100% of those premiums. But that is an option, and for a lot of individuals, it's going to be part of the solution, at least for that next season of health insurance coverage. Another option would just be to look at your spouse's employer. So if your spouse is working, consider whether it would make sense to jump onto their plan and be a part of their group plan. So that may be an option for you if your spouse is working, because whenever you've separated from service, that's a qualifying event for you to be able to come in at say midpoint in the year, not during open enrollment. You can still do that. You can still join in because you've had a qualifying event from separating from the company that you were working for. Third option would be to evaluate the health insurance exchanges through the Affordable Care Act. So if you go to healthcare.gov, each state is going to have different types of policies that are available, and the coverage options and really the quality of those coverage options is very state dependent and state specific. So some state coverages are a little bit better than others. You may live in a state where they have great exchange policies. You may live in a state where the policies really aren't that strong. And then a fourth option would be to look at underwritten health insurance, which is going to be similar to, say, if you were applying for a life insurance policy. There's going to be some health screenings, some disclosure of your healthcare background and your overall level of health for you, for your spouse, for dependent kids, anyone who's going to be on that policy. If you're in relatively good health, your family's in relatively good health, that type of policy can be really cost effective and can be a good option for you to think about. So those are sort of the 4 key options. So COBRA coverage, or joining your spouse's coverage through their work, looking at the health insurance exchanges, or potentially looking at underwritten health insurance coverage. So I thought it would be good now to maybe focus a little bit on COBRA, because for most individuals, COBRA is going to be part of the solution for that next season of life in terms of your health insurance coverage. So again, COBRA is available if there were 20 or more employees at the company you were working for. That's where COBRA is going to be an option for you. You have 60 days from the time that your last benefits ended. You've got 60 days to enroll. So you've got a little bit of a window of time there to be making a decision about what you want to do. The COBRA coverage and the associated premiums for that coverage are retroactive to when your previous benefits would end. And keep in mind, you're responsible for 100% of those premiums under COBRA. COBRA is usually available as a general rule for 18 months. So you have 18 months of coverage. There are times where you can actually have longer coverage available for your spouse or for your dependent kids. That can go up to 36 months if you were to pass away, if you became Medicare eligible, or if there was a divorce or a legal separation there within the family unit. So those benefits can go out a little bit longer in those instances. Something from a risk standpoint to be thinking about, COBRA can actually be dropped. So if the company that you were working for drops their group health insurance coverage, then that would mean that your coverage through COBRA is also dropped. If that company ceases to be a going concern, the company basically folds and stops operating, then certainly the group health insurance is going to stop operating, within that company, and that would also impact you. So that's a risk thing to think about whenever you're looking at COBRA. But if your COBRA coverage ends, that's another qualifying event for you to be able to then go and look at other options that we already laid out there. We talked about the premiums, that they're relatively expensive on COBRA, but one thing you can do is use health savings account dollars or HSA dollars to cover those premiums. So if you've built up some cash in an HSA account, you can use that cash to cover those COBRA premiums, and that's a good use for those HSA dollars. So just a couple of outside-the-box things for you to be thinking about in terms of how to use COBRA or how to incorporate this into an overall plan for you. You've got that 60-day window that we talked about, so to make a decision about whether you want to opt in to COBRA or not. Let's say, for instance, you had separated from service, your benefits stop, and your 60-day time period has started to begin. So you've got 60 days. Let's say you're 30 days in, and you haven't haven't made a decision yet for what you want to do on COBRA. If during that 30-day window you've consumed some health care, you've gone to the doctor, you've gotten some bills, you've incurred some expenses for health care that you've consumed, and then you decide at that 30-day mark, hey, I'm going to go ahead and opt into COBRA. Again, that coverage is retroactive, so keep that in mind. The premiums are retroactive, but those bills that you've incurred during that 30-day window, they're going to be covered under that health insurance COBRA plan. So that gives you maybe a little bit of peace of mind about how you're consuming health care in that 60-day window. And then one other thing to think about is when you have dependent kids, sometimes it can make sense for yourself and for your spouse to be covered under COBRA. But it may make sense to find another health insurance option for your kids. So maybe that's the health insurance exchange. Maybe that's an underwritten health insurance policy for the kids, because just from a cost standpoint, that can save you some money, having them covered under something other than COBRA. I know it can be really complex. It's a lot to think about, a lot to bite off whenever you're evaluating health insurance coverage, especially whenever you're going through some sort of career transition. So if that's you and you're trying to evaluate what makes sense for you, please reach out to us. Don't hesitate to give us a call or an email and let us know how we can help. We're glad to be a sounding board for you and help you make sure that your health insurance coverage really aligns with what your needs are. Thanks so much. Hope you have a great day.